Hello everyone, good day. Look at this. Yes, this is what we've got from the St. Luke Medical Clinic after we took the 2 days medical exam. So today's video, I'm going to share to you the experience that we had when we took the medical exam. But before anything else, let me introduce myself. I am Mary, a K1 visa applicant, and I have 2 children with me. They are called derivatives and they are as well applying for K2 visas. Now, if you haven't seen my previous video before about the preparation that we had for the medical exam, just click on the link that I posted in the description below, and don't forget to subscribe on my channel, hit the like button, and drop your comment below and let me know what you've been thinking. And if you have questions, I am very willing and able to respond to your questions as much as I can. So let's get started. A night before, I prepared everything that we are going to bring for tomorrow. I prepared our food to eat, the clothes that we are going to wear, and the shoes that we are going to put on. Let me give you a short recall on the documents that I prepared. There are 6. First is the passport for each of us, and then the photocopy of the passport containing the biographical data page, and then the 2x2 pictures, 4 pieces, letter coming from the NBC with a case number, the confirmation page of the registration online, and then if you already have set your appointment already for the US Embassy, yes, I brought that as well. And then extra government issued ID, because in case they're going to ask me, because I am bringing 2 children with me. And so those were the documents that I prepared. So actually we woke up at 3 o'clock in the morning. I just gave my children 30 minutes to eat and to put on clothes. And then at 3:30 we left the hotel, and then 45 minutes before 4 we arrived at the area, and I was amazed because there were already people lining up in there. So we queued, and then we waited for an hour and a half until the security guard ordered us to line up properly. And so he checked the documents of each of the applicant and seeing to it that they don't miss anything. And so I noticed that the security guard was very strict in terms of the photos. He checked if we followed the guidelines posted on the website. So during our turn, he arranged our documents accordingly. And then he put a mark on our arms for mine and to my children. I think it indicates that our documents have been verified, and he ordered us to get inside, and he also gave us priority number. So we went inside. There's a room in there, and there are a lot of counters. Yes, and so we sit down. The room was so comfortable because it's air conditioned. And so we waited for we waited for 15 minutes, and our name was called. So I went to the counter C, if I'm not mistaken, and then the staff there asked me personal questions like what my name is, my birth date, and then who is the petitioner. And then she also asked me about my period, if I had my period, when was the last time, when was the first date and the last day. So I answered her correctly. And then that's the area where the personal information of the applicant is being encoded, since I already registered online. So she just retrieved my information online by just using the code that is found on my confirmation page that I gave her. And so that's what she did. And then she asked me to, aside from the encoding of the data, it's where as well the fingerprinting scanning happened. So she asked me to scan my index finger 4 times, and then I also paid the amount of no, not payment, but she told me to pay the amount at the second floor. So after she scrutinized, she encoded our data, she gave me an order to proceed to the second floor, and so we did. The second floor, yeah, at the second floor, not in the second floor, in the 5th floor, we just used the elevator since it's quite far. So we lined up there. So since it's early, there were only few people in there. So I was being, how do you call that? I was being entertained. And so I paid the amount of 7,025 pesos for me. And then I paid 10,583 for each of my children. So I paid almost 37,000 in all. So after that, the cashier ordered me to proceed to second floor for the interview, how do you call it? Vaccination interview. So yeah, we went downstairs, and then I gave our documents to the receiving area, and then the personnel in there said that just wait for your turn, ma'am, your name will be called. So we waited for actually 30 minutes, 20 to 30 minutes after our name was called. And so we got inside the room, and there's a doctor in there sitting at the interview room. And then I was entertained first, and then the doctor asked me personal questions like what my name, my age, about my period. And then she also asked me health related questions like if I have maintenance, if I have asthma, if I have maintenance for the high blood pressure, if I have undergone major surgical operations. And gladly my answer almost was no. And she asked me if I was bitten by cats and dogs before, if I received rabies vaccines. I said no. And she asked me if I had chicken pox before, and I said yes. And she looked for my scar, and so I showed my scar to her. It's on my face. Yeah, she gave me a mirror, and so I gave it, I checked my face in the mirror, and I located my scar on the face, and she said yes. And she as well asked me if I had vaccinations when I was young, and I said I think so, because I have scars in here, which she looked for it, and I showed it to her, and said okay, that's perfect. And then she asked me if I have children. I said yes. If I deliver them normally, and I said yes. And then finally she said that I'll be having 3 vaccinations at the 5th floor. But before that, I have to go to the 2nd and 3rd floor for laboratories. And so my part was done, and so it's my children's turn. So I need, the doctor asked my assistants in my presence, because they are minors, so most of the questions were asked. I personally answered them because I know their history, medical history. So the same questions being asked by the doctor to me and to my children. And so I'm glad that my children are healthy. They don't have any problems in terms of health. And so she explained to me that my children will not undergo x-ray, but they will have the so-called IGRA instead. And I asked her what IGRA is, and she said excuse me, IGRA it's interferon gamma release assay. It's a kind of test that would examine a patient on if she or he has tuberculosis. So before they called it TST, it's tuberculin skin test, but they changed it to IGRA. And so I said, okay. So she gave us an instruction to proceed to the next room for the IGRA test. Well, for me, she also explained that my 2 children will be receiving vaccines. Like my daughter will receive 6 and my son will receive 5, since I asked her why they are not the same. The doctor explained to me that since my daughter is already 14 and she hasn't experienced chicken pox, so she has to be given 6 shots, including the bulutong or the chicken pox vaccine. So we proceeded to the next room, the same floor. As I've said, there were only few people in there since we're early, so we were entertained after we waited for around 5 minutes. And so we went inside the room. There's a staff in there, very friendly staff. And so she got the blood tests coming from my children. They were scared, but I just told them, well, it's okay. There's no pain, there's no glory. So that's it. So they were able to survive. And so the staff instructed us to proceed to the 5th floor for the physical exam. But then I had to go to the 2nd and 3rd floor, so I just brought my children with me to the 2nd floor and let them waited at the center where there were chairs intended for the applicants. So at the 2nd floor, I gave my document to the receiving area for the urinalysis. So yes, I just waited only for 5 minutes, and then my name was called, and then I went inside the room for the urinalysis, and the same procedure. I was asked by the staff in there personal questions like my name, my age, and then about just 5 questions personal, and then she gave me the cup where I can okay, she gave me the cup where I can collect my urine sample in there. Well, they're so hygienic in the room, in the comfort room. There are toilet papers in there, and there are basins where I can wash my hands. And then after that, the staff just put some mark on my documents, maybe just a checklist that I was able to undergo urinalysis already. And so I proceed to the next part, to the left part of the counter where the blood testing was. So I went inside. I just gave my document again to the counter, and then the staff told me to wait for another while. So I waited for again 3 minutes, and then my name was called, so I got inside. And then they got a blood sample from me, and I asked her for what that sample for, and they said it's for gonorrhea, syphilis, and HIV testing. And so okay, it's okay. So actually I really was nervous. I actually was scared of the needle, but I survived. Okay, after the blood testing, I went upstairs for 3rd floor. Fourth floor for the X-ray. The same process. I went to the counter to give my document, and they just said that my name will be called. So I waited for around 10 to 15 minutes because the people started to file up on that room. And so after a while, my name was called, and the staff instructed me to get inside a dressing room where I can change my clothes to a lab gown for the X-ray. And so I did. And then that's what happened in the X-ray. It's normal. And then after that, I went out and I get my document again, and the staff told me to proceed to the 5th floor for the physical exam. So that time, I and my children went in there. It's her time for the physical. So I give our documents to the receiving area, and then Yeah, we proceed to the step 1 where our vital signs were checked, our height, weight, blood pressure, and then after that we are given instruction to proceed to the step 2, closer next to the area for the eye testing. So it's okay if you can't read, if your eyes have grade, if you wear glasses or contact lenses, it's okay. It doesn't affect the result. It's just that for record purposes. And so glad that my eyes are healthy, no grades at all. And so the same process my children experience, they had to undergo eye testing, and then after that the staff in there told us to proceed to the next step for the physical exams. So I and my daughter went to the same room, and my son went to the separate room since he is a male. So we waited in there. So the people in there started to pile up, so we waited, I think, for more than 30 minutes, but it's okay. And so it's my turn for the physical exam. I went inside, leaving my daughter outside. And so the doctor, it's a small room, there's a bed, and so the doctor asked me very personal questions. It's still health related questions, like the same thing they asked me when I was in the laboratory exams, like I was in the blood testing area. And so, but there was a question that I was not prepared answering. It's the question like, have you committed suicide before? And I was like, no. And then yeah, the question was like, if I have allergies, food allergy, medicine allergy, if I have skin problem, if I have problems in my heart, kidney, lungs, liver. And I said no. She also asked me if I have undergone major surgical operations. I said no, I delivered my children normally. And she noted everything, and then she asked me to undress myself. So I did, because that's what I expected in physical exam. So I undressed myself, I removed my clothes, my jeans, and she said, at that time I was wearing jeans and just t-shirt, and then just sneaker. And then she said to lie down on the bed with my bra on and with my panty on. I just lie down there for 20 seconds, and then she just touched my neck, just like that. And then she asked me questions if it's painful, and I said no. And she touched here and touched my tummy, if maybe to check if there's something wrong, a tumor. She asked me if I have tumor, and I said no. And then she touched there, and then she let me turn side, and then the physical exam was done, was finished. So I said, thank you, doc, and she's instructed me to proceed to the counter, US counter. And so it's my time for my daughter and son. So I actually accompanied them in the physical exam. The doctor asks the same questions as they did to mine, except for having about delivery. And so I'm glad that my children are healthy. And the physical exam lasted only for, I think, 2 minutes or 1, just very short. So yes, so that's all for our medical experience. Then after that, I gave our documents to the US counter, and then I think we waited for 5 minutes, and it was 10:30 in the morning. So our names were called, and they gave us instruction, our passport, and the checklist, and yeah, were given back to us. And the staff from the US counter gave us instruction to come back in the office tomorrow at 2 p.m. And I was so happy. I was very, very happy, because finally we're done on the first day. And on the second day, we went there at 1:30 in the afternoon. There were already people lining up, and then we asked the guard where to go, and the guard just checked our documents and verified the code, patient's code. And then she put a mark on our arms again and instructed us to proceed to the where we are Where are we at? Yeah, she instructed us to proceed to the first floor, and so drop our, yeah, our passport, no, the document to the box at the counter A. And so I dropped in there our the documents of the three of us. And so the staff collected our documents and called our name individually. And then as our name was called, yeah, the staff from the counter instructed us to proceed to the second floor for the vaccination. Actually, my name was first called and I was worried about my children, but I instructed my daughter to just listen to the counter if their name was called and listen to the instructions. I am just in the second floor because if I had to wait, maybe people will be lining up and it's time consuming. And so I went to the vaccination room and I received 3 shots. It's tetanus, measles, and flu. So that's it. It was kind of painful here and here. My arms were numb right after. And so I went down and to check my children. And so minutes later, their names were called and we proceeded to the vaccination room at the second floor. And that's the climax thing where they are going to receive 5 shots and 6 shots for my daughter. Actually, it was very, very scary looking at them being pinched with needles. And I told them, well, it's okay. That's for your own good. That's for your protection. And we're happy that we have that kind of vaccines. Actually, they are very strict. They kept on checking, asking about me and my daughter about our the last time we had our period. I don't know, maybe because the vaccines, if you are pregnant and you receive vaccines, it is very, very dangerous. It would kill the baby inside you. So maybe that's why one of the reasons why they very strict in terms of that. And so finally my children were so brave. They were able to fight the needles. And then yeah, actually right after my daughter received 6 shots, we went down as per instructed by the staff for the releasing of our document. But then when we were waiting there, my daughter cried. Maybe she could not bear the pain anymore, and I said, it's okay, it's done, baby, so it's okay. And so yeah, the staff told us that maybe we will get fever at night, so and if it's painful, we have to apply a hot compress on the area where the shots were given. And so yes, yeah, we feel very tired and actually we felt numb. Our arms were numb, but yes. And so we left at the medical clinic at around 4 in the afternoon, and we went directly back to the hotel because yeah, we felt something wrong with our body, and so we get rested. Luckily we didn't get the fever. As I've said, we are all healthy, praise the Lord. And so that's it. And before we left, of course, the staff gave us this. At the releasing area, they gave us this. It has an instruction, do not open, to be opened only by the United States consular officer. So she said to bring this along with us during our interview. And there's also, for me, she gave this to me. Yeah, I don't know why. Maybe it is the record of my x-ray. And she said I have to bring this if I get to the US. And then, aside from that, 3 envelopes, she also gave us records of our vaccinations, and she instructed us to take photos of it in case of emergency. We lost it, we have a soft copy for this vaccination, which is very, very important, very helpful when we look for a job or when they enrolled for school. So we got this, and I think it's positive because the consequence, if you've got a problem in your lungs, on the second day they won't allow you to be given shots. Instead of telling you to go to the 5th floor for the shots, they would tell you to proceed to the third floor for repeat x-ray. And aside from the repeat x-ray, if you have problems with your lungs, if they found a patchy or a scar on your lungs, or an area where there is a patchy or cloudy marks, they will tell you to undergo sputum test. And I was really worried and praying that, Lord, please help me, because a month before I had a lung problem. Actually, I had an inflamed lung, left lung, because I had a medical exam and the doctor found out that my left lung was inflamed. I was worried, and I told the doctor that I will go to Manila for a medical exam because I was applying for a visa, and the doctor gave me an antibiotics treatment for my lung infection, and it's pneumonia. And I was so scared, and luckily that it was treated. After I got it, I had a repeat x-ray, and the result was clear already. My lungs are healthy. So I was kind of worried about it, but so that's why I'm so happy today that we received this. It means that everything was well. So I know, guys, you as well are worried and been preparing so much of things for this medical. Just think positive, and I know that God has a better plan for each of us, and just trust Him. Okay, so that's all for today. And for the next video, I'll be updating our preparations for the U.S. Embassy interview, which will be on May 23rd. So I'll be posting videos on our preparations and our experience right after. So you guys take care. Have a great day. See you. Bye.